Welcome everybody to the webinar series of Ashtanga Ayurvedics Private Limited. We have been running successfully for the past year. We have been conducting various webinars, inviting various specialists, and they have been gracious enough to give us time to give talks on different and very versatile, very colorful topics, giving us the idea on many parts of diseases which can be taken care of by Ayurveda, and thereby giving the public a view that Ayurveda can do many things what they might not have known till then. I'm very happy for this being the 22nd webinar of the series. Uh, First, I would like to have an introduction of K.S.Varier Ashtanga Ayurvedics from the Executive Director, Mr. T.R. Sivakumar, sir.
Thank you, Dr. Girish. It's always a proud privilege to introduce Ashtanga to you all. So K.S.Varier's Ashtanga Ayurvedics Private Limited was a proprietary company started in 1936 by Ayurvedian K.S.Varier. At that time, it was only a diploma course, so he was known as Ayurvedian. And Ayurvedian K.S.Varier studied in Kottakkal under the guidance of the founder of Kottakkal, P.S.Varier. So he was one of those three people, contemporaries, who came out of Kerala and established institutions outside of Kerala. So K.S.Varier thought of establishing it in the central part of Tamil Nadu, and he came to Trichy to establish his own company called Ashtanga Ayurveda Shala. And since then, it has been happening. So in 1999, we converted this to a particular company that is a registered company. And after that, it has been a private limited company running like this. So K.S.Varier was a doyen in his own field. He has treated millions of people. He has treated many stalwarts at that time. And he has also treated animals, to say a few things about his own expertise. He has treated the elephant of our own Malakotai or Rockford Temple. And the elephant lived for 2.5 years, having declared with cancer. And that was an achievement for him. So after that, it went on, and K.S.Varier passed away in 1990 at the age of 83. And after that, it has been his sons who carried it forward. And I, being the grandson, joined the institution in 1995, and I've been here since then. The company is a private limited company. We manufacture about 300 products, and we supply our medicines all over Tamil Nadu, Karnataka, and part of Kerala. So this is a brief history of K.S.Varier Ashtanga Ayurvedics Private Limited as it is known today. I wouldn't like to take more time from the speaker, so let me give back the mic to Dr. Girish.
Thank you, sir. Thank you for that wonderful introduction of K.S.Varier Ashtanga Ayurvedics Private Limited. Now, moving on to today's speaker. The speaker is a very versatile person. Introducing him would take as much time as his session because he is a very colorful and vibrant person. We are very proud to have you in our community, Dr. Sivakumar. A brief profile on the guest is Dr. Sivakumar comes from a family which has practiced medicine for generations. He is the son of Dr. A. Ramalingam, a graduate and eminent physician from the field of Siddha, and Dr. R. Meenakshi, a graduate and distinguished practitioner of homeopathy medicine, both being the descendant of renowned families from South India who practice Indian medicine traditionally. Even though Dr. R. Sivakumar was born and brought up in the metropolitan capital, the most happening city of South India, Chennai, his love for Indian medicine made him join the pioneer of all medical systems in the world, the Ayurvedic system of medicine. He finished his graduation B.A.M.S from the famous century-old College of India, the Venkatramana Ayurveda Medical College, Mylapore, Chennai, and did his master's specializing in Kaya Chikitsa from another famous 64-year-old college, Hubli Ayurveda Seva Samitis, Ayurveda Mahavidyalaya, Hubli. During his post-graduation, he did his research work on osteoarthritis and proved the concept of chondrogenesis, possibility of redevelopment of cartilage in the joints through Ayurveda, which the contemporary system of medicines are still researching on, for which he is greatly appreciated by the Department of Ayush, Government of India, New Delhi, at the centenary celebrations of the Government Ayurveda College, Mysore, Karnataka. He had consistently been a top performer through his graduation and post-graduation, and graduated as one of the leading mark scorers. He had been practicing Ayurveda even before completing his internship throughout his UG. He got well trained under Dr. L. Mahadevan, Director Sri Sharada Ayurveda Hospital, Kanyakumari, and Dr. A. Ramalingam while doing his PG. He had been a part-time consultant in WEKAS and Srinivasa Snehakshema Abhivriddhi Society, SSKAS, an NGO in Hubli. His desire to develop multi-specialty hospitals in Ayurveda made him to do his MBA in hospital management from Alagappa University, Tamil Nadu, during the same time of his post-graduation. He is now a notable faculty of the Department of Internal Medicine at Sri Sairam Ayurveda Medical College and Research Center, Tambaram, Chennai. He teaches final year clinical subjects for the students and is also part of the medical team handling the OPD and IPD patients of the college attached hospital. He presently holds the post of Secretary for Ayurveda Postgraduate Association, Tamil Nadu, first of its kind in India, is also the secretary for All India Ayurveda Congress Chennai unit and represent the organizations at all levels, and been an important personnel in bringing out the first government Ayurveda college at Kottar, Nagarkoil in Tamil Nadu. He has presented numerous research papers in challenging diseases and has given informative guest lectures in schools, colleges. He also continuously writes health articles in newspapers, magazines, and addresses media, TV channels frequently. He is an active member of the Rotary Club of Chennai Golden Star and will be holding a very important post of Assistant Governor of Rotary International District 3232 for the year 21-22. He is presently the Associate Director, Maternity and Child Health, RID 3232. He does many free medical camps on behalf of the Rotary and frequently addresses the public and gives lectures on the uniqueness of Ayurveda and its benefits through Rotary, Lions Club, and NGO organizations. He runs specialty clinics at Coimbatore, West Mambalam, Shinoy Nagar, Mugaper West, Tiruvannamalai, and Shivagangai, and treats people in distress. He is an expert in Panchakarma, through which he cures innumerous diseases right from the common cold to cancer. Arthritis, stroke, psoriasis, asthma are his specialties. He has his own multi-specialty medical facility, first of its kind in Chennai, the Chennai Heritage Hospital, a state-of-art 30-bedded multi-specialty hospital in Ayurveda and Siddha, and efficiently runs the hospital as its medical director. He is the past president of the Rotary Club of Chennai Golden Star and has done remarkable works during his tenure as president in the field of projects, Ayurveda awareness, membership, etc. He was even awarded with the Best President Award in the Rotary year 1819 in the Rotary District 3232, India. Ulaga Tamil Araichi Niruvanam, Government of Tamil Nadu, has felicitated him with the prestigious Dhanvantari Award recently for his contribution towards ancient medicine. He was also conferred with Ayurveda Nakshatra Award by the Ayurveda Graduates Association of Tamil Nadu for his contributions to Ayurveda. These are his achievements, Dr. Sivakumar. I think I took most of your speaking time itself just to introduce you. I feel very honored to have introduced you to our participants here. I welcome you, Dr.
Telling
Sivakumar.
the whole set of things to people, but it is not necessary to read everything.
No, the thing is, I did try to cut short the parts of it, but then I thought these are things which people should know, what Ayurveda can actually do to the society. So I wanted people to know this. So I just wanted to take that time. I'm sorry if I took a lot of time, but anyways, Doctor, so before starting the session, for everybody's notice, you can all put your questions in the chat box. Please mute yourself during the session so that we do not have any interruptions in between when the speaker is speaking. Any questions you want to directly ask the speaker can also be done during the question answer session. So right after the session, the question answer session would follow with a great interaction from our speaker. Let us all have a great session. Thank you all. Thank you. Dr. Sivakumar, please take up the stage.
Good evening, all. First of all, it's a great honor to be here on behalf of Ashtanga Ayurvedics, an age-old company which is still following the basics of Ayurveda in preparing the medication. So in that way, because recently, all the commercial things happening even in our industry. But I'm very proud to say that I'm using Ashtanga Ayurvedic medicines, and I'm seeing very good results compared to even the best companies in the market. Even though Ashtanga Ayurvedics name is not commercially known, probably that is the reason why they are not commercially known. If they are commercially known, the quality would definitely come down. So in that way, I would definitely recommend Ashtanga Ayurvedic products. And no matter now, I've become one of the family of Ashtanga Ayurvedics now, and happy to be here to present one of the challenging cases. It's not a life-threatening disease initially, and but in the recent time, as we already saw, many commercial things are happening in the health industry, and we are able to see corporates coming into the health industry and suggesting many costly treatments for simple diseases. So in that way, we know that osteoarthritis of the knee joint and psoriasis, then leukoderma, vitiligo, so many diseases are effectively being managed by our system. We all know that rheumatoid arthritis is one disease where we can all achieve a good result, better than the modern medication. But there is one topic which is even right now not being discussed widely by Ayurvedic physicians. The topic is gallbladder stones. So this was there in my mind right from my schools, right from my college, to say exactly. Because I used to see my father treating gallbladder very easily, but others taking it as a big challenge. So I thought, why not to go ahead and do a research on it? But of course, there were some constraints and things, so I was not able to take this topic as my postgraduate dissertation. But this was my first suggestion to the committee. But later I was given osteoarthritis, but that was a different story. But my thirst for learning about gallbladder and managing it was never low, even after various hindrances. And I would proudly say now that my hospital, Chennai Heritage Hospital, is one of a pioneer center to treat gallbladder stones. We have recorded many cases, we have documented many cases, and I hope I can share that with you in this meeting. Let me get into the presentation directly.
Just a minute, doctor. There is a slight echo coming from your side. If there can be some correction, it would be much better. The hearing experience, the listening experience will be much better.
Vignesh, can something be done about this?
Checking, sir.
Yes, please.
My audio better? Am I audible?
Yes, sir.
My audio better?
Yes,
So,
sir.
we can hear you, sir. This clear.
Is it okay now?
Yes, sir.
Okay. Yes. So let me share the presentation. Yes. The latest update is I've resigned my post. I wanted to full-time practice, so I have resigned my post from Ayurveda College, Sairam. So I am now the former professor there. I am not the current professor. Yes, so this is my hospital, as already explained by Dr. Girish. Yes. So I don't want to get into the anatomy because most of us know what is gallbladder stone and gallbladder, of course. But there are some technical terms which I would like to explain, or rather detail it before getting to the presentation. Because many of us, even being doctors, people get confused. Many students of me practicing Ayurveda after their UG, still they get confused with polylithiasis and polycystitis, polydipolithiasis. There are so many technical terms now we are able to see in the USG and MRI. So cholecystitis is a condition where we get an infectious gallbladder. It might be because of the irritation caused by the stones inside, or it might be anything else which can cause an inflammation. It can be an infection which is causing an inflammation, that is cholecystitis. Cholecystitis, which is grade 2, grade 3, may not be treatable in Ayurveda. So let me give you the exclusion criteria first, then getting into the inclusion criteria. Whereas plain cholelithiasis is definitely manageable even if it is not in acute stage. Even if it is in acute stage, then we might need to take chances. And if it is blocking and there is cholecystitis along with cholelithiasis, then better to refer the patient for acute management rather than giving our medications. This is from my experience that I am sharing. I might change this opinion when I treat much more cases. So as you all know, cholelithiasis is uncomplicated gallbladder stone which is staying inside, but the patient doesn't have any big complications. Cholecystitis is inflammation of the gallbladder stone, gallbladder. And cholelithiasis is when there is stones which is getting formed inside the ducts. So this specifically happens when we don't treat the nidana. Rogam madau parikshe tato anantaram aushadam. So in Tamil we say noi nadi, noi mudal nadi, adadaniku maya nadi vaipache. So if we are not treating the cause and removing just the gallbladder, there is another reoccurrence of gallstone. People wonder how it happens because there is no gallbladder, then how the gallstones happen? But the gallstones do happen not in the gallbladder, but in the duct, in the common bile duct and hepatic duct, and that gives a lot of complication. You need to put in stents there to have a better living there. So that becomes more complicatory when the gallbladder is removed priorly. So surgical criteria, as I already told, when there is a second grade or third grade cholecystitis with acute symptoms and fever is there, which shows inflammation, then it's better to refer the patient to a modern hospital for surgery, what we generally call as Dhanvantari Sampradaya. So Ayurvedic criteria for management. Many people say that, sir, how do we see this? There is one single big stone. There are numerous small stones. There is gallbladder sludge, gallbladder slurry. So many things are there in the report. How to see it, how to manage it. So generally, with the experience that we have done in our hospital, I would say up to 14 mm is definitely manageable from our side. 14 to 20 mm, you have to take chances. You have to explain the patient that 3 to 4 months you take the medicines. If there is a reduction, continue with it, or then go with surgery if it is disturbing you, or else you can stay, put it aside and take care of your own job. That's the way we generally say, because gallbladder stone is pathology for humans. But if you see animals, even when an animal dies, they cut the gallbladder and calculate the age of the animal by seeing the stone size inside the gallbladder. So the formation, like what we get, like the wrinkles on the skin, the white hairs, the baldness, the same way when we age, gallbladders do cause stones inside. But only in humans, when it gets as stones, we might have a fear of getting obstruction and obstructive jaundice and so many other things, then cholecystitis and all these things. That's it. But otherwise, in animals, we don't see much of complications. So the same way, if it is accidentally found out, then we always tell the patient to wait, do not go for surgery, even if it is a big stone inside the gallbladder. But small multiple stones is actually a favorable category to treat in Ayurveda. Usually, there are so many types of stones, but the cholesterol stones are easy to manage. We will not be able to peculiarly find out what kind of stone the patient is suffering, because in renal stones, we'll be able to gather, or by checking the urine calcium and other oxide levels, we'll be able to find out what kind of stones the person may be experiencing. But in gallbladder, that is difficult. So finding out the stone and treating is nearly impossible in gallbladder stones. So let us see what is the criteria to treat gallbladder. So you know the basic anatomy of a gallbladder. Let me not get into deep into it. So here you can see the cystic duct. So when the gallbladder is removed, the gallbladder is removed along with the cystic duct, but the stone gets formed in the common hepatic duct. So that becomes a problem, and you need to go for stenting. We cannot go for Ayurvedic medications at that point of time because it will be an acute problem. So that is why we often need to preserve gallbladder, because it's like a storehouse in our home. Whatever unwanted things we put in the storehouse, and we keep our home fresh and hygienic. The same way, the excess gall is being stored in the gallbladder, and the duct and other things are preserved. So unnecessarily, gallbladder removal should not be done, because right now we see in many corporates, as soon as accidentally a stone is found out, the doctor suggests to immediately go for a surgery to remove it. They say that you might land up in having a cancer, you might land up in having a infection later, gallbladder may burst. All these things are there, but the chances are very remote. It may not happen to everybody. So we have to wait until we get problems. Otherwise, start the treatment immediately. Yes. So as already told, there are different terms that we have to see. Cholecystitis, cholelithiasis, cholangitis is infection of the bile duct, and cholelithiasis, cholestasis, which is flow of bile juice which is being blocked by some other pathogenesis. So these are the common types of gallstones. So cholesterol stones are being the commonest forms. Yes. So these you would have seen in your textbooks and internet already. Usually we say that 4 F's: fat, female, flabby, fair females used to get gallbladder stones easily. Here also I'm trying to say the same. 40 plus females, lack of melatonin, folates, calcium, magnesium, vitamin C, increasing age, family history, obesity, metabolic syndrome, diseases like Crohn's, diabetes, liver diseases, gallbladder stasis because of lifestyle or because of spinal cord injury, constipation, less fuel consumption, birth control pills, pregnancy. All these things are the general causes and risk factors which are mentioned in our textbooks, the modern textbooks. But I would go one step ahead and say that there are certain other positive factors which we will see shortly. So this, of course, we all know, but still we don't document this. But I would urge all our physicians to document this, because late food, omitting or leaving away the morning food, so that is very important. People who have gallbladder stones, they tend to omit their morning breakfast. So that typically in this 4F definitely causes the gallbladder stone. Late foods, when people do not take food on time, they do develop gallbladder stones, and they do not chew well. Many people do not chew well. We have so many restrictions in taking food. Food is a spiritual experience as per our culture and as per an Ayurveda, but it is a social event in Western world. Now we have converted our food intake as a social event. That is why we are landing up in so many problems, including gallbladder stones, choking, and cholesterol, and so many things. So non-chewing is one of the reasons. Na hasyam, na jalpanam. So many things are given. Na ati drutam, na ati vilambanam. Not slowly, not fastly. Na ati shitam, not cold. Na ati ushnam. Na jalpanam, na hasanam. Don't speak, don't laugh during your food. All these restrictions are told only to properly mix your saliva. When you chew, you mix your saliva well. That becomes a big neutralizing and breaking factor for your food. Your food is converted into simple foods only when you mix your saliva well. And when that happens, your food gets digested well, and there is no cause for the gallbladder to put into a pressure. Non-fibrous food. We always say that include more of vegetables in your food, but recent past, this culture is slowly changing. We are taking more of the stable foods, rice, wheat, and other things, but we have started reducing our vegetable intake. So that can also be one of the reasons. Reheated oils. Many people go for hotel foods. They stay they stay in rooms. They go for marketing. They keep on roaming. They eat whatever they want in roadside shops, bhajis, bondas, and vadas. All these things. So that may not be the cause, but the cause is the late time and the quality of food. That is one important thing what we have encountered in the cases in our OPD. Chronic constipation. Most of the gallbladder patients complain of chronic constipation. So this is one thing. Less water is, of course, a reason. Over fasting, as I already told you, many people do not eat food in the mornings. So that can cause gallbladder issues. And people who are very religious and go for fastings every now and then, they are also we are also seeing such people who do not have a good physique and still they go for a fasting. We are able to see gallbladder incidences in them. And late night sleep, of course, is one of the reasons. Yes, when we come to Ayurvedic view, many people think that Ayurveda, Ashmari, so it is a stone, it is Ashmari, so it is formed in Pittashayam, so it is Pitta Ashmari, so we have to go for Pitta Ashmari Chikitsa. But I would not recommend Pitta Ashmari Chikitsa here. Pitta Ashmari, certain things will be helpful, but we have to see this in the purview of Gulma. When we go for the Panchasthana of Gulma, Vastir Nabi Krit Parshvam, so 12 Parshvam. So there you can see that gallbladder comes under the 9 abdominal quadrants, and hence it has to be taken as a gulmam, and we have to start treating it as a gulmam, and then only we will get good results rather than treating it as a Ashmari. So, as I already told, in modern medicine, there are 5 Fs. I didn't tell about the fertile female because 40 comes under the fertility, fertile factor also. So fatty, 40, fertile, female, and flabby. These are the 5 Fs which are classically told in modern medicine. I would say 6 S from Ayurveda. It is Snigdha, Shweta, Staulya, Sukumara, Sri, and Shilangata. So this 6S, I would say we have termed this coin, and this you can see in our case sheets, in our documentation also. Why we should go for all modern documentation. So let us go for our own documentation. So I put 6S, and we are able to see most of them positive in gallbladder stones. Yes. So you know the pathology. I don't think I need to explain this in detail. So the bile inside the gallbladder solidifies and forms the gallstones. So it is very small in size initially, and then they get into grains of sand and then as large as pebbles. Yes, signs and symptoms, as I already told, in most of the cases, gallbladder stones are found out accidentally because the patient goes for something else, for a routine scan or for a uterus scan or for something else, and accidentally it is found out. So most of the patients, it is asymptomatic. Symptomatic gallstones will be from mild dyspepsia to nausea to vomiting to abdominal discomfort and even to biliary colic and obstructive jaundice. So from mild to severe, you can see various range of symptoms in gallbladder stones. So biliary colic is nothing but a sharp postprandial epigastric or right quadrant pain lasting for several minutes to several hours. The patient may throw up. He may have a projectile vomiting in case of gallbladder biliary colic. The pain may even radiate to the back and to the shoulders, typically the right shoulder. So many people do not complain pain at this area of the gallbladder, but they complain the pain at right shoulder. So if they have some gastric discomfort with pain in the right shoulder, then it's right to go away for a USG abdomen. Then if obstruction, then you get Tilavarcha Varchas. So that is there. Then Murphy's sign will always be there. So some acute symptoms can also be experienced, and at this point of time, we may not be able to treat these patients. We need to refer the patients to the modern medicine, or we can give some anulomanam medicines and see if the symptoms subside. If it is not subsiding, and if the patient has projectile vomiting with the symptoms of cholecystitis like fever, which is not coming down, and then it's better not to take such cases. So as I already told, treatment criteria, when the wall becomes thick, then it means that the cholecystitis is setting in, so we may not be able to treat such a patient if there are acute. And as I already told, size of stones about 10, below 10 is easily curable, up to 14 is manageable. 14 to 20, you can say we can try. Definitely above 24, we never take patients. Number of stones, single solitary big calculus is big challenge for us, and the small multiple stones is often easy for us. And when there are symptoms of sepsis, infection, and cystitis, we will not be able to treat such patients. And when obstructive jaundice is there, then we have to see what can be done there. And acute symptoms along with sepsis, infection, and cystitis is there, better to refer the patient. And when the patient says these things, it might mimic MI, and sometimes MI may mimic gallbladder stones. If the patient already has a gallbladder history, you might think an MI as a gallbladder stone and start treating it, then we will land up in problems. So often try to rule out MI in such cases. Then, as I already told, without an abuse, by removing the gallbladder, will often land up in having cholelithiasis. So that will be a big problem. We will not be able to treat that case. So better not to remove the gallbladder. Yes. Gallbladder prevalence as per our hospital, males it will be 28%, females is about 72%. Then age prevalence, you can see that 41 to 50, we have major patients at 41 to 50, whereas in 31 to 40, we have next set of patients. And in 50 to 60, the incidence is little lower. 60 above, again, we have some instances of gallbladder stones. And when you see the symptoms, as I already told, the patients who come to us in acute phase is very less. We often see asymptomatic patients. Elsewhere, they would have gone and done a scan, they would have found out a gallbladder stone, but they do not have any disturbance. But since they have found out the stone, they come to us. So that is how about more than 30% of the patients come to our OPD. Whereas they will have simple digestive disturbances in about 20%, 25% of patients, and mild epigastric pain and hypochondriac pain in about 35% of patients. So these are the major problems that we see in patients, and often this digestive disturbance and epigastric pain do not have any relationship between the gallbladder and the patient, even though he has a gallbladder stone. When you treat this as a simple case of amapachanam and things in Ayurveda, we are able to see a good relief in the patient changing into asymptomatic phase in spite of having a gallbladder stone. Yes. So as I already told, we have also documented cases as per the sizes. So this is a gallbladder stone size together. So here we can say more than 1.5 cm. We had some set of patients which we were only trying. We cannot include them and we cannot see big improvements in such patients because the stone itself is big enough and it cannot move inside the gallbladder, and treating that becomes a difficulty. And this is one interesting view. Non-vegetarians in our OPD has more instances of gallstones than the vegetarian counterpart. And BMI. So when it comes to BMI below 25, the instances are less. When it goes above 30, the people we already saw Shitilangata, Fabi, Flatty and all, fatty and all. So such patients have more incidences. And when we see the constipation, as I already told, a strong history of constipation, definitely the patient is going to suffer from gallbladder. You can very well tell this point blank to the patients when they come for constipation. So relieving the constipation is very important. What we call as Vada Anulomanam in our system has to be priorly done. If it is not done, then it lands up in having a more susceptibility to have a gallbladder stone. Then the frequency of erratic food is again there in the history of gallbladder stones. When we come to treatment principle, it is Pitta Kavahara Chikitsa. It has to be a Gulma Hara Chikitsa. If not, it is not usually an Ashmari Hina Chikitsa. Associated symptoms can be treated along with the main treatment because most of the patients will have asymptomatic gallbladder associated with gastritis, acid peptic disorders, ulcers. So often they feel that the stone is causing all the problem. You clear this, the stone stays there, but the patient is healthy. So that is very important in treating these patients first. So treat the associated symptoms also. So it will be Snehaharam, Rukshaharam, and Deepanam, the treatment principles. So usually it is the Rayantyadi or Varanadi Kashayam. Varanadi, as you all know, have Kapha Medoharam and Avarnaknam principles, and Rayantyadi is Turai Pund. So it is very effective in stimulating the gallbladder and breaking the stones. And Varanadi, since it has Balatakam, Balatakam is, as you know, it is like an Amridam in Ayurveda. So there is no Kapha disorder which cannot be treated with Balatakam. That is what Acharya Charaka says. Then we can even go for Pulathadi Kashayam. Then there is something called as Pune Mise in Siddha medicine, which we often give to patients of gallbladder stones, which get a good result with Pune Mise Kashayam. Yes. Bringaraja Kalkam can be given if you find some changes in the ACPT, ACOT levels. If you find some fatty liver and other things associated with gallbladder, then Bringaraja Kalkam can also be given. Apamarga Churnam can be given with Pulatha Kashayam. Shadharanam can be given. Mudavata Anulomanam. So Arogya Vardhini. Later, in the later phases, we can go even with Draksha, the Shamanam. And in Basmas, there are certain Siddha Basmas which are being tried in our hospital. The one is Nandikal Barpam, then Kalnar Barpam. Kalnar is Gaure Ashma in our Ayurveda. Then Vediu Kuchinnam, Ayakantam, Kasisam, all these are drug of choices in a patient of gallbladder stones, uncomplicated gallbladder stones. Then certain liquids can be tried in Ayurveda. We say Jambira, the Panakam, Incops manufactures it. It's a very effective medicine. And if you see the Falasruti of Jambira, the Panakam, all the gallbladder symptoms come in the Falasruti. They have not mentioned it as a gallbladder specific medicine, but you can see all the Falasruti mentioning of gallbladder symptoms there. So Jambira, the Panakam, Ingutrigana Thailam can be given with the Bringaraja Swarasam, Madulunga Rasayanam, Nannari Manapagu, Jirakarishtam. All these are according to the symptoms. These drugs can be selected and can be given. Patya, yes, of course, Mulakam, Dadima, Upputa Mamsam. Often in certain cases, we generally say to avoid Mamsam, but in gallbladder stones, Upputa Mamsam can be given because it is Ushnam and it helps in breaking of the stones. And it can push, it can put the pressure on the gallbladder and push the stones if the stones are smaller in size, they can be pushed into the lumen and can pass through the intestines and come out in the stools. So Kulakam, Shikru, Trikatu, Kaidariyam, Madulungam, Molakam, Sakaram, all these can be definitely given. And with all these things, if you ask me, the success rate in our hospital is about 73%, which I would say is a good success because we are still learning, we are still updating, and we will strive hard to make this much better. I would also recommend Ashtanga Ayurvedics to come out with a patent product which can help gallbladder, because there are so many medicines in the market, so many companies. I would openly say that there is no company which come out with a gallbladder specific medicine. In the total market of about 3,000 drugs in Ayurveda, patent medicines and Shastric medicines, we will be able to see hardly 2 or 3 preparations for gallbladder, but the patients we encounter are very much large in number. So if there is a good research on gallbladder along with some patent medicines brought out, it would be much appreciated. And I would suggest our team of Ashtanga Ayurvedics led by Dr. Varier sir and K.S.Varier sir and Dr. Girish to work on it.
I'm sure we will be able to do this with the help of your own experience.
Yes, sir, definitely. So this is one patient which I wanted to discuss here. He is still my friend, is Mr. Gokulnath. So he had multiple stones with gallbladder polyp. And when he came to me, his bilirubin levels were higher, his AGP, TSGOT levels were higher. And you can see that the stones were only 3 to 5 mm. So I didn't suggest him to go for a surgery. It was in 2012. You can see the date there. He had a mild temperature running, and he had chills with the temperature 2 weeks back. But when he came to me, he was in a much stable manner. So we started some medications, and his reports I'll share in the next slide. So you can see this as his first report, which is in June 2012. So here you can see liver is enlarged, gallbladder showing multiple calculi 3 to 5, and evidence of polyps in the gallbladder. And this is his MRCP report in June 2012. Then we saw it in July 23rd, 2012. The multiple gallbladder stone has come into few mobile calculi in the gallbladder. So largest measuring 4. So it was 3 to 5 mm, and then it changed into few, and it has become 3 to 4 mm here. And then it comes to 6th month of 2013. You can see there are no gallbladder stones here, only few polyps are seen. Why I'm sharing this report is a very old report, 2012. You might ask, sir, you are taking care of so many patients, and why you are putting a very old report? Why I am presenting this report is because this patient recently came back for a review in 12/2020. You can see the scan report in the right side, which is 12/2020. The scan report speaks for itself. You can just go through the report meanwhile and have some water. So in 2020, when he came for some other issue, we were suspecting some gallbladder involvement in that. So we went for a scan. He was, of course, when he, after 2013, 6th month, we didn't have a follow-up. He didn't come back, but later after 6-7 years, he came back to me. So we did a scan, and we were able to see no gallbladder stones even after 7 years. So this is very important in treating a gallbladder stone. There should not be any recurrence. So with that, I will finish my presentation. I once again thank the management of Ashtanga Ayurveda for giving me this opportunity to present about the gallbladder stones today. Thank you very much for patient listening.
Thank you, sir. Thank you for that short and sweet presentation on treatment of gallbladder through Ayurveda. I think quite a lot of people would have been enlightened by certain facts. I myself I have noted down certain things which you have mentioned on the treatment side. I am also expecting a few questions from the group here. So I think we can go on to. Shall we move on to the question answer session?
Yeah, sure.
Yes, sir. So we will move on to the question answer session. A few questions are coming up. So there was a question which I had noticed earlier itself, which you had just put it in the slide also. Can rapid weight loss increase the risk of developing gallstones? Now, I would like to add to that. Can you please give us an explanation on why the rapid weight loss is actually going to cause this problem?
Yes, of course. Rapid can cause gallbladder stones if it is not planned wisely. If you are going to concentrate more on fasting, that leading to a rapid weight loss, then we already saw it is going to trouble the internal metabolism and can cause gallbladder stones. We saw that in the Nidana.
Yes.
So, yeah, answer is the same. The question is in a different form. That's all.
Yes. The next question is: could gallstones be dissolved spontaneously after labor among pregnant women? What is the best management in these cases?
So, if it becomes after labor, then it is just treatable like any other patient. So, you don't need to worry. The challenge is during pregnancy only, it is a big challenge because you have a rising pressure built inside the abdomen, which is going to put a compression on the gallbladder. So many people experience gallbladder stones only during pregnancy. So that is also there. That becomes a challenge.
I think there is also the limitation of medications which can be given during that time also.
Right. Yes, right.
How probable is cancer in gallstone patients?
Yes, cancer in gallbladder stones also is. We are seeing such patients, but we often tell them to go for surgery when it is confined only to the gallbladder. Because as modern medicine says, we also say that gallbladder is one essential organ, but when that can cause a trouble to the full body, and if the disease is only confined to the gallbladder, that time it is better to go for a surgery because it may cause multiple other complications if it is left that way. It can spread through all the abdominal organs. So it's better to remove it that time, not to manage with Ayurveda. With the limited experience that I have in cancer treatment, I say this.
Thank you, sir. So the next question is, sir, can you please try and reason out why superficial or abdominal fat increases the risk of developing cholelithiasis?
Oh, see, cholelithiasis, not only cholelithiasis, when we see patients of superficial central obesity, central adiposity, we have a risk of getting more free radicals used in the body. So when you go for an apple, you cut an apple and keep after half an hour, the apple becomes brownish in color. So that is because of the influence of free radicals. The same way, when you have central adiposity, you have a lot of negative hormones being produced in the body, and these free radicals will disturb uh, every other system of your body, including the bile secretion and the gallstone formation. So central adiposity also indirectly tells us the patient is fat, probably flabby, probably shitilangata, all these things. So again, under our discussion already.
Thank you, sir. I think I need to. Yes, sir.
See the central obesity. Central obesity, when I speak on lifestyle diseases, I speak on this topic in a very detailed manner. Central obesity is one single big reason for all the non-communicable diseases that we are facing now, because central obesity leads to, it's often seen as a sign of prosperity. After 40, when people get the central obesity, we see it as a sign of prosperity. Okay, I'm aged, I own a company, I own a hospital, nothing wrong in having a tummy like that. So that is how we feel now. But that opens a whole lot of new diseases to world of new diseases to our body. Right from obesity, you get hypertension, hypertension leading to cholesterol, hypertension, cholesterol leading to diabetes, hypertension, cholesterol, diabetes leading to heart diseases, cancers, and whatnot. Everything comes. All is built upon one single factor, which is called as central obesity. So even gallbladder comes later.
Yes, sir. Thank you. I think I need to mention here the question was put forth by Dr. Rekha TA from Bangalore. I have had the good fortune to have worked with her for a short time when I was in Bangalore during that time. She is working with Sridhariam. She is a great ophthalmologist and ENT specialist. Hello, Dr. Rekha, ma'am.
Hello, Dr.
Hello, sir. Hello to all whoever has been hearing the lecture. And good evening, Sivakumar, sir. Nice to meet you.
Good evening.
Nice to hear you.
Thank you.
It was a good lecture indeed.
Thank you.
Thank you, ma'am. So next, moving on to the next question. How good are the traditional liver medicines in treating gallstones?
I'm not sure what you mentioned by traditional liver medicines. You mean Ringarajam and Bhumi Amalaki, or about the apple cider vinegar, which is seen in the WhatsApp for gallbladder stone? I'm not able to understand the question. It might be traditional liver medicine. Usually it is Ringarajam, which is
I think the person who has put the question is looking at traditional liver medicine, including the Bringaraja and the classical medicines for liver.
okay. Okay. So liver medicines is probably, I think K.S.Varier sir has put forth the question. So I think he is expecting Shastric or gallbladder.
The types of Vasha and all that.
So yes, in certain conditions, the regular, as I have already put, Arogya Vardhini, Bringaraja Kalpugam, all these things are definitely helpful in management of gallbladder stones. It all depends on the condition. If you encounter a patient with the symptoms of Kamala, then we have to go for Vasa Gudichiyadi and such other medication. So definitely we cannot avoid or omit their importance in gallbladder stones also, because gallbladder in Ayurveda comes under the umbrella of Rogam only. So we cannot just bypass traditional Ayurvedic medicines in the management of gallstone. But of course, if there are some specific medicines in asymptomatic gallbladder stones, it would be much better, because there is often a confusion and hesitation in gallbladder stones in our Ayurvedic fraternity. So that is why I recommend your kind self to bring out a medicine, a Shastric medicine, because there's no, actually the market is big and there is no medicine actually there.
We'll work towards it, sir.
Definitely, sir.
Yes, sir. So moving on to the next question. Namaste, sir. Patient age 55 years, female with multiple gallstones, largest is about 8 mm, with DM and hypertension since 15 years. What can be line of management? Okay, that's a direct question on management.
I think if you go back to the presentation, you can see all the management there. We have already discussed everything there. So depending on the condition, you can go for Varan, Rayantya, Gambira, the Panakam. Then you have certain Siddhar preparation can be given in the form of basmas. So they can be given in the form of basmas in honey. Then there is something called as Vediyu Puchinam. So all in the later phases, Draksha, the Sairam. So all these things I think we have discussed. So because patient 55 years female cannot give us a whole history. No? We always go for Ashtanga Pariksha, Trivida Pariksha, and also what is, whether the patient is Sukumara, whether he will be able to take all these medications, whether he is he has the ability to undergo Shodhana. Shodhana, of course, Virechana. As I already told, Anulomana is a part of the treatment. So Virechanam can also be done in patients of gallbladder stone in asymptomatic period.
Thank you, sir. I think that should answer the question. The next question is it mandatory to do MRCP for all gallstone patients with CBD dilation, or CT is enough to diagnose?
Okay. When we see an USG, we tend to miss certain gallbladder pathologies in USG. And when we go for anything above that, let it be a CT or let it be an MRI or MRCP for that matter, it is fine. So it is the question has to be like whether USG abdomen is enough or we have to go for CT or MRI. There is no big differentiation between CT and MRI. But of course, if you have some doubts in CT, you go for MRI also. Because in certain conditions, when there is gallbladder wall thickening and all, MRCP will give you a better picture because you are seeing it from inside. You know? Whereas CT is just a type of X-ray. It is computerized tomography. You see from outside only. So this is much better. MRCP is the final test to be done in gallbladder. Of course, a costly affair. Most often USG scan alone will be. But all you have some confusions in USG scan, then you can recommend the patient directly go for MRCP, not the CT. Because even if there is a doubt in CT, again you have to tell the patient to go for an MRCP. So better to go for MRCP. But I would say that such an incidence in your clinical setup will come probably in 1 in 10 patients. That's all. Most of the patients will come to you with an MRCP only. You don't need to worry about it. They'll go see everything and finally only they'll come to you. So that's how things are.
That's true, doctor. So moving on to the next question. Okay, there is a point as well, very informative. Never thought of gallbladder stones giving so much trouble as a layman. Thank you, doctor, for sparing your invaluable time with Ashtanga and sharing your experience. So this is from our MD, Mr. K.S.Varier. Another question, any ways to take care of the sludge stage of cholelithiasis?
Sludge is a collection of the size of 1 mm and 2 mm. So it is the same management there. Sludge is nothing but 1 mm or 2 mm. So it will be the same management there.
Okay. Moving on to the next question. Nowadays, patients going for cholecystectomy more often, and after that they develop hyperacidity and nausea. Even some patients have constipation after that. They approach the Ayurvedic consultant. What could be the line of management in this type of condition?
As I already told, parallelly, asymptomatic gallbladder will be there and the patient will have some GI disturbance. So most often these two do not coincide. Gallbladder stone will not be causing such problems in such patients. So just treat with the simple Pulmahara, Amapachana, Deepana Chikitsa, Sanulomana Chikitsa, Amlapitta Chikitsa. So that will be more than enough in such patients. And once they get better with all these things, probably you can think of going for gallbladder stone treatment.
Thank you, doctor. So
is that a question asked if post cholecystectomy these symptoms are there? What is the treatment? Is that the
yes.
Okay. And after that they develop. Okay. So if they develop, I think in such cases also, like modern physicians say, gallbladder is only a storehouse. So you have to be little conscious on your diet. You might need to advise the patient to be little conscious of the diet, because little amount of fat in your food is easily digestible with the regular flow of the hepatic juices from the liver directly. You don't need a gallbladder store reserve for digesting heavy fats there. So if you are little conscious on that, if you advise your patient to be little conscious on that and treat for the basic amlapittam, that will help the patient. He may not develop symptoms at all. That will be more than enough.
Yes, sir. There is a question which I got on my phone. So even after the cholelithiasis treatment, can we go for Grita medicines in the patient? Okay, that I think is a valid question.
Yeah, definitely you can go with Krita treatment. There is no problem because we have given Snehapanam in patients who have done cholecystectomy already, but they don't have any problem in fat digestion at all. So it is all the patient's comfort. If the patient says, no, I don't have, because he would have become a Satmya for Krita right from his childhood. So we have that concept, no Oka Satmya. So if he is somehow he has got a problem with gallbladder that is removed, that is a different story. But if he still says that my digestion is better and probably that is an accidental gallbladder stone finding and accidental surgery being done, definitely you can go ahead with Snehapanam. It is not going to disturb because basically you are going to stimulate your liver by Snehapanam. So the involvement of gallbladder is not necessary there.
Thank you, sir. I think such a question comes to practitioners when most of the patients, when they come to the practitioner and when we plan out treatments, including the Grida, the first thing the patient says is my allopath had told me not to take any fatty materials, including ghee medicines, which are given in Ayurveda. So I personally have seen such comments come out of patients.
One of my close friend who is a gastroenterologist, when you ask him, sir, what is the how can we avoid gallbladder stones? He would say, yeah, he is basically from South India. He would say, daily ஒரு ஸ்பூன் நெய் சாப்பாடுல போட்டு சாப்பிடுங்க. You will never have a history of gallbladder stone at all. That is what he says. Because as long as you keep the gallbladder active by giving Grida daily, the gallbladder completely compresses and throws all its content for digesting that Grida. So it will never store anything. But modern doctors, contemporary physicians say you are taking more fat, that is the reason for gallbladder stone. But what kind of fat? Refined and putrefied fat is what is the cause for gallbladder stones, not the pure fat as in case of our Kritam. So I would definitely say that our Kritams can be definitely given as long as all our purifications have been done.
Yes, sir. Obviously, because in our classical texts also, which talk about Gritapanam in cases of GI disturbances specific to with signs similar to gallbladder stones and liver issues, we do notice that Gritam is given the first and main importance there.
Yes. Because there is one more thing. See, whenever a patient comes for Shodhanam, you will not be able to see scan for every patient. No, we will not be able to know whether he has a gallbladder stone or not. So that is immaterial. So you don't need to worry on that. As far as you have done Amapachanam and the digestion and things got better, you can definitely go with the part. Not a problem at all. Post cholecystectomy, still if the patient says that he is not having any digestive issues and he takes all the food well, then you can definitely go ahead with Gridapanam. And of course, Gridapanam, we are going to go with Arohana Sneha Karma only. So you give the Prasiyasi Matra, there itself you can decide whether we are going to go ahead with the Gridapanam or not. There itself we will be able to decide. So that's not a problem. But holding the patient without the treatment, hesitating to give Snehapanam, I don't accept that. We have to try. We have to counsel the patient and start with Gritapanam. Because Gritapanam nowadays is a big challenge to make the patients accept and give it. That is a challenge, but still we will be able to do it.
Very true.
Have Pravicharana Sneham and all. So you can mix Sneham with any kind of thing that he wishes. So anything can be mixed. Even Madhyam can be mixed and given. That's what our Shastra says. So that's not a problem.
That's true, sir. So moving on to another question. So during the 1 second. Okay, this is not a question. This is a remark, a very informative session, doctor. So I think they are all happy. Most of the, I am finding a few more remarks here also in the chat box. Thanks for the informative and very useful webinar to Dr. Sivakumar, sir, and Ashtanga Ayurveda. Thank you, sir. Very informative session. I have learnt a lot personally. Thank you for the informative and enlightening webinar to Dr. Sivakumar sir and Ashtanga Ayurveda. Okay, what is known about gallbladder epithelium regeneration? There's a question there, sir.
I'm not very familiar with that question, so I don't think I'll be able to answer that. Because epithelium, we generally mean the innermost lining. In certain cases, the innermost lining get disturbed, like in case of our intestines. We have the innermost mucosa getting eroded. So I think the person is asking about that, but I'm not sure.
Yes, sir.
I don't have an answer.
Sure, sir. No issues. We have another question. What about the diet during cholelithiasis treatment?
Diet, we generally tell the patient to go with less of oils. During that time, because if the stones are big, there is a chance that the gallbladder gets compressed and the stone gets blocked and other complications come. So we will tell the patients to go with less of salt. And in the last slide, I've put what are the pathyas. So all those pathyas can be definitely had, like Kaidarium, Moolakam, Chakram. All these can be frequently had. Only spice, not spice, oil can be reduced. That's all. And of course, the Nidana Parivarjanam has to be followed. The patient is a late eater. The patient does not, the patient skips their morning food, if they take a refined oil and all the junk foods, and all these things have to be definitely avoided. Nidana Parivarjanam is very important. Along with that, Sneham. So we have to reduce the Nikta Padam.
Thank you, sir. So another question, sir, is it the criteria that if patient diagnosed with cholelithiasis, then he has to go for cholecystectomy, or is it chance that we can manage with our medication?
See, the whole presentation is about that. If we are directly going to suggest cholecystectomy, then the very purpose of all of us sitting here together to discuss this, the very purpose of documenting all these patients for the past 11, 12 years is not necessary. But definitely, as I already said, about 14 mm, till 14 mm, multiple stones, uncomplicated, definitely you take a chance. Explain the patient and take a chance. Definitely you get a good feedback there. 14 to 20 mm, you need to advise the patient to see if there is any change for the first 3-4 months. The patient is very hesitant to go for a surgery. And if he has symptoms frequently, then you need to advise the patient to take our medicines and see for 3-4 months. And if nothing is happening, then better to go for a surgery. And about 24 mm, definitely directly refer the patient for a surgery. This is from my experience. This is not part of Ayurvedic suggestion. This is Dr. Sivakumar's suggestion based on my experience. And I'm telling you, we are trying to research more on this. We are trying to find more literary reference and trying to implement them from so many recent author books like Gadanikraham and all these things. So if we are able to suggest, if we are able to succeed, probably in one more seminar after 5 years, 10 years, we will meet under the banner of Ashtanga Ayurvedics again. And I may give you that last time when I presented, I was wrong in these things. I'll give you another update like that I can tell.
Thank you, doctor. So
let that happen. Let that happen.
Learning is a continuous process. So if we say that we have learned everything, then that is the first day of our destruction. No? So learning is a continuous process. Every time we update ourselves, every time we open Charaka Samhita, we learn new. The same line sounds in different ways when you read it at different ages. You know, we generally say, no, in Mahabharatam, if you see as a physician, you read the book of Mahabharatam and Ramayana, you get all the medical references. As a dancer, if you read the book, you get all the references. As a cook, Nalabhagam, you read the book, you get all the references of cooking. Like that, Charaka Samhita, when you read, it is a medical book, but the same line will convey different meanings as you get the experience. So that is how things are. Even beyond the explanations of the commentators, you get new dimensions and new ideas when you read your textbooks again and again. So I urge all the physicians here to read your basics then and there, and refer whenever a patient comes, refer the books, not just the internet, but your shastras.
Thank you, sir. Thank you for that advice. There is one more question. Good evening, sir. Can we correlate gallstones with Kamala or Halimaka or Kumbhakamala? If yes, what will be the treatment protocol?
Yes, we already saw gallstones do happen with obstruction, and it can be a Kamala. It can lead to Halimaka or Kumbha Kamala also. So in such cases, we also have Asadhya Lakshanas. So if Asadhya Lakshanas are there, Bekha Varnam and all is there, then it's better to not to take that patient because he is in the verge of getting into sepsis and multiple organ failures. So probably we may not be able to treat it. And once again, I'm saying I'm mainly concentrating on gallbladder stones. So I don't have much experience in treating this. In one of my PGs, when I was doing my PG, my teacher, Dr. Prashant A.S., most of us know him from Karnataka. He's a stalwart in PG. So we had a patient of gallbladder stones with many complications. His bilirubin was 32. So we went with G-Mutagan Nasyam. G-Mutagan Nasyam, we refer, we read many a time, but we never do it in practice. But now we do it in our hospital. So we did that, and we were able to see a lot of fluids coming out through the nose, and we collected these fluids and checked it. We were able to see a rich concentration of bilirubin in that fluid, and his bilirubin levels came down to 14 that evening. And if you refer any Davidson or Hutchison, you cannot explain this, but this is how the Shastra is. So definitely such patients, if we are able to treat, if such incidences happen, it is a learning. When I learn, I will definitely share that.
Thank you so much, sir. That's a very important gem of information you just shared. I think all of us agree to that. There is a comment. Excellent session. Thank you, doctor. So I think we are at the end of the question answer session. Any more questions for anybody? Would you like to ask questions directly to Dr. Sivakumar, sir? If so, you may unmute and ask. I would like to add that the feedback link has been shared in between. Twice it has been shared. I hope all of you would have seen the link. Please give your feedbacks. Any more questions from anybody? I think with that we come to the end of this question answer session. I would like to ask our medical superintendent to give a few words if he has finished his traveling and if he is able to speak up through the webinar because I know there would be issues with the internet connection. Dr. T.V. Narayanan, sir.
Yes. Okay. Yes. Yeah, I am back at home.
Yes, sir.
Hello, Dr. Sivakumar.
Hello, sir.
Very happy to see you. You have just a very nice presentation.
Thank you.
Now, what I have experienced,
Sir, definitely your input is necessary here.
because in many cases I have seen the IBS connected with this.
Okay.
That may be a problem that is due to Pitta vitiation. So generally what we are doing here is that is Brannavadi or Guluchyadi, Vasa Guluchyadi, then Drakshadi, those type of medicines we are even tablets that Chandra Prabha, even Kalyanasharam we used to give. So we have got better relief, and of course we cannot expect a sudden relief with our medicines. It will be very slow only. So even 6 months to 1 year it took. Completely, it is normal. So even Kalyansharam, I think you can try in your hospital.
Definitely.
It's a very good medicine for this particular disease. Okay, thank you for your presentation.
Thank you. Thank you.
Thank you,
Thanks
sir.
for your input, because sir's input for his experience is definitely a boosting factor. I'll definitely start trying Kalyana Kaksharam, of course, from Ashtanga Ayurvedic itself.
Thank you, sir. So I would then ask our MD, Mr. K.S.Varier, to speak a few words on today's session.
I think he is left.
Okay, he has given a feedback in between that feedback of very informative. Never thought of gallbladder stones giving so much trouble as a layman. Thank you, doctor, for sparing your invaluable time. So that feedback is from our MD. Would you like to add something on the today's session, Mr. K.S.Varier, sir?
I don't think I have anything to add. He has given a fantastic presentation. I think the presentation was very simple and very understandable. What you have done is actually enlightened us with a lot of ideas about gallstones, because gallstones, I don't think we get many cases here. I'm not very sure. The clinicians should say that. But I've not heard much about gallstones. One or two cases that come out along, I think we refer back to the allopathy. I've not heard much occasions where you have been discussing gallstones in our doctor's meeting. So I'm not sure about that. But then, all said and done, I'm sure with the help of Dr. Sivakumar here, we will definitely go in for working towards a product which will be for gallstones specifically. Let's work towards that with the help of Dr. Sivakumar, because he has the experience in that line. I'm sure Dr. Sivakumar will help us. So we will go ahead with this. I think Kalyana Kaksharam we don't manufacture right now, but if you have a requirement, yes, we will, because we don't have the volumes right now. So we choose to buy it from other people, other manufacturers. So if
when I started using Kalyana Kaksharam initially, the Ksharam has to have a certain point of pH. But when I checked the pH of the good company's Ksharam from the market, because one of my friends was doing his MD thesis on BPH. So for him, we tried to purchase Kalyana Kaksharam from the market from very good companies. I would not like to name them here. And we checked the pH, because Ksharam means in order to work like a Ksharam, it should have a more of alkali nature. But all these Ksharams were measuring around 7, which is neutral. So that time we lost hope in using the Ksharams. So that is why I am not using Ksharams. Since I also have a company, we do all this backside research on the products also. And whenever Kashayams like Varanadi, Guglu Tiktakam, Gridam and all is given, the patient is very comfortable, then we stop buying those medicines. Because as medicines, since Balatakam is there, they have to create some problems to the patient. But if the patient is very comfortable, then it means that Balatakam is not there.
True, sir. To the executive director, we do have a lot of gallstone patients. Under the guidance of able guidance of Dr. K.S.Varier, we have been treating them. I think all of our doctors here can vouch for that we have been at least seeing.
I'm not updated. I am not updated because we have not been discussing this case, case about gallstones in our meetings normally.
That's
so I'm not updated. I'm sorry.
It is mostly we do take such cases under the guidance of Dr. T.V.N. sir. So within his patient.
20 years back, we never had medicines for BPH. We never had medicines for thyroids. We never had medicines for PCOD. But now in the market, you can see many medicines are coming. Of course, they are combinations of our old products. But when the patient gets these medicines like thyroid norm, thyroid nil, the patient feels happy. Okay, the doctor has given a very specific medicine for me. Of course, the medicine is going to act 60-70%. It is going to act because they have only our Shastric medicines Paranadi, Punarnavadi, Kanchanara, Gupla, all these things will be there inside.
Yes.
Pangabasmam, all these things. So, like that, why don't we bring a product for gallbladder? So that is my long-term.
We can work towards it,
I
doctor. It's
tell
not a, it's, no, it is not a challenge at all. We can work towards it.
I have noted it down, doctor. So I move towards that. We'll come out with a good product.
We'll work together.
As a company, when you approach doctors, if you manufacture Mahanarayanam, at least 300 companies are manufacturing Mahanarayanam. So entering into a doctor's clinic with a gallbladder specialty product is much easier, because the doctor will definitely try the medicine. No?
True,
and
true.
if it's little bit effective also, then we surely
Yes.
market there.
I get that. I get that. We will do that. We'll work on it. Thank you very much for the session, doctor.
Thank you.
It's been quite an experience.
Thank you, Dr. Krish.
Thank you, sir. With that, we come to the end of this session. We have another comment. Excellent session. Thank you, doctor. So thank you for giving us your valuable time, Dr. Sivakumar, sir. So it was great having you here. I would ask you now in front of everybody for more sessions so that we continuously keep updating ourselves with your experience as well, sir. So,
And next time, let us both connect to Deva and ask him to come here for the sessions. I didn't see him today.
True. Maybe he's coming in through the YouTube live broadcast.
Maybe.
There are quite a few people who are coming there. I did check it out in between. So,
Okay.
So I think we have come to the end of this session. It was a great session. Thank you, Dr. Sivakumar, sir. And thank you all of you for participating here and making this session a wonderful experience. Thank you all.